this lesson we'll learn about cataract. The lens is a remarkable structure that in its normal state of functions to bring images into focus on the retina. A cataract is any opacity in the lens. Aging is the most common cause of cataract, but many other factors can be involved, including trauma, toxins, systematic disease such as diabetes, smoking, and heredity. The lens is positioned just posterior to the iris and is supported by zonular fibers arising from the ciliary body. These fibers insert onto the equatorial region of the lens capsule. Risk factors for cataract development include the following, like diabetes or elevated blood sugar, steroid use, smoking, ocular disease, and uveitis, ocular trauma, prior ocular surgery, and genetic predisposition. Symptoms are blurring of distance more than near vision, increasing myopia, poor vision in dark settings such as night driving, decreased contrast and decreased ability to discern colors, glare, monocular diploma. This class will talk about 5 common types of cataracts. They are age-related cataract, metabolic cataract, secondary cataract, traumatic cataract, and congenital cataract. First one, age-related cataract. Have 3 types for cortical, nuclear, and subcapsular cataract. First one, cortical cataract, starts as clefts and vacuoles between lens fibers due to hydration of the cortex and evolves into wedge-shaped or radial spoke-like opacities. Nuclear, often associated with myopia due to an increase in the refractive index of the nucleus. When advanced, the nucleus appears brown. Subcapsular, there are 2 types. The anterior lies directly under the lens capsule, and the posterior lies just in front of the posterior capsule and appears black on retinal emulation. The latter often has a more profound effect on vision than a comparable nuclear or cortical cataract. Metabolic cataract, often seen in diabetes. Hyperglycemia leads to the overaccumulation of metabolic produced in the lens, innately leading to fracture, refraction, and later to cataract, particularly accelerated age-related nuclear. Secondary cataract. Many systematic diseases can cause cataract, like chronic anterior uveitis and high myopia. Traumatic cataract, including penetrating trauma, blunt trauma, electric shock, infrared radiation, isoline radiation, and congenital cataract. Prevalence, approximately 3 in 10,000 live birth. Rarity, 2/3 are bilateral, and morphology may indicate likely an etiology and viral prognosis. Lamar opacities may be AD or occur in infants with metabolic disorders and intratumoral infections. Blue dot options are common and enormous. Central oil droplet opacities are characteristic of glioblastoma. Posterior polar cataract may occasionally be associated with presence hyaloid remnants or persist posterior fetal visual. Treatment, we use focal mostly. The definition is Most cataract surgery is performed using phaco, in which the nucleus is broken down within the eye using ultrasound. And the techniques, the first one, we use a continuous circular opening in the anterior lens capsule, and the second, we use the IA. And the third, we put the IOL into the capsule bag. Other techniques include manual extracapsular cataract extraction, also called ECCE, and the intracapsular cataract extraction, also called ICCE. The intraocular lens, also called IOL, is optimized for positioning within the intact capsular bag, although complicated surgery may necessarily elevate, such as placement within the ciliary selectors or anterior chamber. Okay, that's all for this lesson. Thank you for your attention. See you next time.